Hi there viewers. Welcome to our channel. What is breast cancer? Breast cancer begins in the cells of the breast. Breast cancer can either be a tumor, where it grows into and destroys nearby tissues. And it can even spread to other parts of the body. Or it can be non-cancerous, benign, where it does not grow into other tissue, and therefore behaves normally. Some breast cancers begin in cells that line the ducts that carry milk from the glands to the nipple, and this type of cancer is called ductal carcinoma. When cancer starts in lobules, which are the groups of glands that make milk cancer, it is called lobular carcinoma. Even though both types of cancers can be benign and do not grow into surrounding tissues, they can, however, be invasive, as they can invade other surrounding tissues and organs. Now that we defined breast cancer, so what are some signs and symptoms of breast cancer that you need to watch for? Some women who have breast cancer may not exhibit any signs or symptoms in its early stages. Therefore, they would only know that they have breast cancer when the tumor grows large enough to be felt as a lump in the breast, or when cancer spreads to nearby tissues and other organs. Note, you may be having other health conditions that can cause similar symptoms as breast cancer symptoms. So, what are some signs and symptoms of breast cancer? Some signs and symptoms of breast cancer include: Number 1. You may notice changes to your skin's texture. Breast cancer causes so many changes in the breast. One of them is inflammation in skin cells. This inflammation leads to texture changes, including scaly skin around the nipple and areola. Thus, the skin may feel like it is sunburned. Note, you may even notice skin thickening in some parts of the breast. Number 2. You may notice nipple discharge. This discharge can be either thin or thick. The color of this discharge varies. It can be clear to milky, yellow, green, or red. Note, it is always recommended to consult your doctor whenever you notice a discharge from your nipples. This is because this discharge may have nothing to do with having breast cancer. Instead, it may be related to so many other things such as breast infections, a side effect of birth control pills, or other medications that you may be taking, or it may be related to some other health conditions, such as thyroid disease, or other diseases. Number 3. You may notice dimpling in your breast. This dimpling can signify inflammatory breast cancer, which is an aggressive type of breast cancer. This is when breast cancer cells build up lymph fluid in the breast, leading to swelling and dimpling or pitted skin. One of the easiest ways to identify this dimpled skin is that it resembles the surface of an orange. Thus, it is vital that you consult your doctor when you observe dimpled skin for further investigations. Number 4. Lymph nodes changes. First, let's define lymph nodes and their roles. Lymph nodes are located in many parts of your body, and there are hundreds of them. Some parts of the body where you would find these lymph nodes include neck, armpit, and groin. One of the roles of these lymph nodes is that they contain immune cells that fight bacteria, viruses, and cancer cells. When breast cancer has been developed, its cells travel to the underarm lymph node region on the same side as the affected breast, and these cancer cells cause lymph nodes to swell, especially in the armpits and around the collarbone. This swelling can be characterized as small and firm swollen lumps that may be tender when touched. Note, breast infections or other health conditions may cause lymph tissue to swell. Therefore, It is recommended that you contact your doctor about these changes, so that your doctor can identify a possible cause of swelling of the lymph nodes. Number 4. Breast pain or nipple pain. Even though breast cancer is usually painless, it can cause some changes in skin cells that lead to a feeling of pain, tenderness, and discomfort. Thus, never ignore the pain you may feel in your breast or nipples, as it could be one of the signs of breast cancer, especially if you have excessive pain along with some of the other signs and symptoms of breast cancer. Regarding ductal carcinoma, one of the ways you would know that you have developed this type of cancer is when you feel a firm or hard lump that feels very different from the rest of the breast. Thus, if this lump continues and it doesn't disappear, you should consult your doctor. Regarding lobular carcinoma, this type of cancer does not usually form a lump that would warn you. After going through some of the signs and symptoms of breast cancer, it is imperative to note that breast changes you may be experiencing can be caused by so many factors, including aging, breast infection, changes in hormone levels, and other health factors. Therefore, you should not panic or be fearful when you notice these breast changes. However, it is advisable to proactively arrange a routine visit to your doctor and get medical advice about your health conditions and symptoms you are having. Now it is your turn. What other signs have you experienced if you have developed breast cancer? Please share your experience in the comments below. Please remember to like and subscribe to our channel. Thank you.